All right, we're jumping right in today to talk about something pretty wild, a hidden cause of chronic pain. And believe it or not, it might mean your acupuncturist should be asking about your teeth. Think about this for a second. What if that nagging back pain you've been dealing with for years, what if it didn't start in your back at all? What if it actually started in your mouth? Yeah, I know, it sounds a little out there, but stick with me, because this one question is completely changing how some specialists are thinking about treatment.
And this is where we meet Milana Shaikh. She's a licensed acupuncturist, and she starts her investigation into chronic pain in a place most doctors, well, they'd never even think to look. So what's her secret? What's this crucial first step? Well, it all comes down to asking a question that pretty much no one else is asking.
Instead of starting with your back or your knee, Shaikh goes straight to a really surprising place, your mouth. She specifically asks about your dental history, and especially if you've ever had a root canal. Why? Because she's convinced that these procedures can have a massive effect on our overall health. And here's the kicker. It's a connection that she says most practitioners are just completely missing. Okay, but a root canal, why on earth would that matter for, say, your back pain? To get it, you've got to understand a fundamental idea. The body is one big connected system. Right, so you're probably thinking exactly what I was thinking. Hold on, how could a problem in one little tooth possibly cause issues in my back or my neck or even my knees? It definitely feels like a huge leap, right? Well, it really boils down to three key connections. First off, you can have this hidden low-grade inflammation from dental work, and that doesn't just stay in your mouth. It can radiate out and affect your whole body. Then you've got traditional Chinese medicine, which has mapped out these energy pathways or meridians that literally run right through your face and jaw. And finally, modern research is backing all this up, confirming that chronic pain isn't just a local issue, it's a systems problem. And this whole idea fits perfectly with a modern scientific framework called the biopsychosocial model. I know, it's a mouthful, but the concept is simple. It basically confirms that pain isn't just about a damaged muscle or bone. It's a complex mix of biological stuff, psychological stuff like your thoughts and emotions, and even social factors. So if pain isn't just about one specific spot, what does that mean? Well, it leads us right to our next big idea. Pain doesn't stay in its lane. And this is a really powerful insight from Shaikh. She says, and I'm quoting here, most people do not realize that chronic pain affects all the systems, not only the physical status, but also degrades mental status and emotional status. It's not just a physical thing, it's a full body, full mind experience. And you can see how this becomes a really vicious cycle. It starts with the chronic pain, right? But then that pain wrecks your sleep and messes with your mood. And when you're tired and down, your threshold for pain actually gets lower, which, you guessed it, makes the original pain feel even worse. It's this nasty feedback loop that is so hard to escape. And look, because it's such a complex, tangled up cycle, Shaikh is really upfront about something important. There are no quick fixes here. We're talking about conditions that often took years to develop. Getting better is going to take multiple visits and some real lifestyle adjustments. It's a journey. So how do you break a cycle that complicated? Well, it's not easy. It requires a specialist with a much deeper toolbox, someone who can go way beyond the standard treatment. And this comparison here is super helpful. A standard acupuncturist, they're often focused on the meridian theory, that energy flow we talked about. But a sports medicine acupuncturist like Shaikh does that and bridges it with modern biomechanics, the kinetic chain. Basically, they understand how your whole body is connected like a machine. A foot problem can cause a hip problem, and yeah, a jaw problem can cause a back problem. And to give you an idea of just how specialized this is, in the entire state of Massachusetts, there are only about six certified sports medicine acupuncturists. That's it. It really highlights how rare this particular skill set is. So with that rare certification comes a seriously advanced toolkit. We're not just talking about needles here. We're talking things like electroacupuncture, very specific sports medicine protocols, cold laser therapy. She can even prescribe Chinese herbal medicine. It's a whole different level of care. Okay, so when you take that unique starting point, the teeth, and combine it with this incredible specialized toolkit, what do you get? You get a completely different approach to healing. It's all about seeing the full picture. So let's break down her framework. It all starts with that full system review. And yes, that includes the dental history. It's also about acknowledging the huge emotional and mental weight that comes with chronic pain. It means setting realistic goals and timelines for recovery. And crucially, It blends the best of both Eastern and Western medicine for a truly complete approach. So if there's one thing to take away from all of this, it's this. To really, truly manage chronic pain effectively, you have to look at the whole picture, the whole person, not just that one single spot that hurts.
And that really leaves us with a pretty important question to ask ourselves, doesn't it? When it comes to your own health journey, is your treatment looking at the whole picture?
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.